COVID test, swab, qPCR, antigen, protein. Do you know what all these words mean? What do these mean? Do you know what they mean? Well, I'm going to teach you today. Today's video is about the current gold standard of COVID testing in Australia. Hello, my name is Dr. HS and this is a video from the series Lab Vocabulary in which I teach you some new lab words to improve your vocabulary. In today's video, I'm going to be teaching you about the lab COVID tests. If you need to add subtitles, you can do this by clicking on CC and then choose the language in settings. If the lesson is too difficult or too fast, you can change the speed of the video. You can do this by clicking on the settings and then choose how fast you want the video to go. Currently, there are three main types of COVID tests. There is the nucleic acid detection test, the rapid antigen test, and the serology test. The nucleic acid detection test is more commonly known as the qPCR or the PCR. This diagnostic test is considered the most sensitive for detecting an active infection, and the results are highly accurate. The qPCR is currently the gold standard for diagnosis of COVID-19 in Australia. So how does it work? PCR testing detects DNA, but the coronavirus is actually made up of a genetic material called RNA. So what the scientists have to do is they take a sample, a swab, then they need to convert the viral RNA into DNA, and they do this by using an enzyme called reverse transcriptase. Once this is done, chemicals are used to amplify the DNA, which means that millions to billions of copies are made, so it can be read by the PCR instrument. Serology tests are a bit different from the qPCR test. Instead of measuring genetic material from the actual virus, they measure your body's response to being infected by the virus. So how does it work? When infected with a pathogen such as SARS-CoV-2, the body produces antibodies that bind very tightly to the virus to help deactivate it so that the body can get rid of it. And these antibodies are very specific to each virus, and this binding can be harnessed to develop diagnostic tests. The first type of antibody that your body produces is called an IgM, and this may appear within days of the initial infection. IgM antibodies typically fade away a few months after the infection, and then other types of antibodies are then produced, and they're called IgG and IgA. So what can the results show? The antibody test recently approved for use in Australia can measure both IgM and IgG anti-coronavirus antibodies. If your test shows IgM antibodies, it suggests that you have a current or very recent infection. If you have both IgM and IgG, it means pretty much the same thing. But if you only have IgG, this suggests that you had an infection at some time in the past. The antigen test is called a rapid test because the turnaround time is much quicker than the qPCR test. They're portable, they're scalable, they're easy to use, and most importantly, they can deliver a result in just 15 minutes. So how does it work? From a patient's point of view, the antigen testing works pretty much the same way as the qPCR. A sample is taken with a nasal or a throat swab. And the kit works by detecting specific proteins that are part of the coronavirus. And these proteins are called antigens, and they're present on the surface of the virus. However, these rapid antigen tests don't amplify what's in the sample, which means that they can only detect the virus when it reaches very high levels in a person's body, with perhaps hundreds or thousands or even millions of viral copies. And because of that, they work best in the first week of infection. And this is why they are considered less accurate than the qPCR. I hope you liked the video today. Give me a thumbs up, comment below. See you next time.